that's part of our game plan. Yep.
And the other question I have is, you mentioned if we keep short faces, we could have issues with cherry eye and dermoids, but short faces, regardless of whether we have the head defect gene related to them, right?
Right, exactly.
Because like, we're getting, look at our list of winners here, our top winners were traditionals in a lot of the categories.
Mm-hmm.
But are they still getting dermoids and cherry eyes?
Right. So the discussion is about the dermoids and the cherry eyes. What I think we need to pay attention to, regardless of this craniofacial defect, the cat fancy, what can PETA groups and like that, did anybody see that Dog Breeds expose, where they really came after the British Bulldog, and what's the one with the brain?
Cavaliers.
The Cavaliers, yeah, right? So let's sit and think, what can they come after the cat fancy for? Number one thing is going to be that the short face. That's going to be the number one thing that they can come after. The majority of your cats have that, because the majority of our Persians. But also you want to keep away from extremes. So overall, I think all breeds should be getting a little more moderate in their facial. Not all breeds, but the brachiocephalic breeds should be getting a little more moderate. And also the cats that are too skinny and long should back off a little bit too. So that's part of the bigger picture. Keep in mind, anytime you have to interact with your cats, I have to be there for its breeding. You shouldn't have to be there for its birthing of kittens. It should do it all by itself, all right? Every time you're interfering, that means you keep selecting for cats that are having birthing problems, right? Maybe you think it's fun. You're interacting with your kitties, right? You know, but a cat shouldn't have to have its eyes wiped or anything like that, right? So we were talking about are all inbred cats, is that a problem? Not necessarily, but if they all have exactly the same gene pool, what plagues you guys all the time? Infectious diseases, right? You have to have a good immune system to fight off infectious diseases. So this is where you're kind of teetering, is that when you're getting low genetic diversity, a new infectious disease can come in and really wipe out a program, right? So you want a good, healthy immune system, and not have to intervene with your cats. Those are all signs that you need to put some more diversity into your cats. Bigger litters, bigger kittens, things like that.
Is cherry eye genetic to Burmese? Because I've bred Persians and exotics for 30 years, and extreme, because I'd never even heard of a cherry eye except with Burmese breeders.
I know it's very frequent in the Burmese, but Dr. Little, how often do you see it?
I agree with you, I don't see it in like Persians, exotics,
But
Lyons.
I did an article on cherry eye for a British cat magazine, and the picture they used to illustrate it was a Persian.
Yeah.
I think in terms of
Not frequent, no.
Yeah, not frequent. But let's face it, you make the facial structure that short, not everything can fit in well, and so.
Their eyes don't stick out as far out of the skull as contemporary Burmese.
Yeah, we're talking about two short-faced types of cats,
Yes.
but they're not the same type of short face.
Right.
That's why I think
Right. So we have a whole different project in the laboratory trying to find short face for Persians, because that's going to be different for short face. So that's coming along down the pike as well. So yeah, that tells you this is too extreme. Even the carriers are too extreme. So how do we work back the other direction? Even with the carriers, if out of the carriers we can pick the longest face carriers that we could get, that's moving in the right direction as well. Yeah.
I just had a comment from Brian, who's on Skype, and he said that out of two of his traditional females, he had cherry eyes. So I think it poses the question, there's been a lot of speculation that cherry eyes are only linked to carriers.
Right.
Contemporary carriers, when that's not necessarily true.
Okay.
So is it linked to plain facial structure?
I think the highest correlation is certainly with this mutation, because this mutation affects facial structure. So anytime you're getting the facial structure too extreme, you're certainly going to increase your risk of cherry eye. But why does that not happen as commonly in the Persian? You know, I can't really say what the mechanism is there. Yeah.
And if you look at dog breeds,
That-
yes, I see it a lot more in pugs and Pekingese,
Right.
but Cocker Spaniels and Beagles are also very commonly affected. They are not brachycephalic.
Right. Okay.
They do have more buggy eyes, but they are not brachycephalic.
Right. Okay.
So
So it probably has something to do with the structure of the orbit.
Yes.
Yeah. And not necessarily the shortness of the muzzle, but it's still.
Which says prominent eye.
Right. So this is where, okay, so this is where we get into a very touchy situation of, okay, so we're going to have to do some censuses of, you know, how many breeders do we have out there? How many breeding cats do we have out there? And really get a good evaluation of that. Davis is going to help you with a genetic registry because I know the CFA is not in the position to help you with that right now. If we can eventually transfer, that to the CFA, then they could use it for all breeds. That would be great. That would be something we could absolutely work for. But we will help you with that. So we'll keep a registry of what the coat colors are on these cats, what their head defect is, what their hypokalemia status is, their GM status, and their DNA profile for that individual, but we have to get that data collected as well. And then we have to figure out how we're going to share it. So if you send in the sample, click a box that says you're going to share that information with everybody. Yeah.
I'm Bernice Strazio, Burmese breeder. Along that line, I sent a few samples to you, and I noticed that you have the opportunity to add the cat's microchip number on your form.
Yep.
It strikes me, and would you comment, that it would be quite important to chip the cats that could go into the base that would be...
Yeah, so we could chip the cats. That could be mandatory because that's very easy for anybody to check. But also keep in mind a DNA profile is even a tad better than a chip, but you can't, because you won't lose that DNA profile ever, all right? You can never alter that. You can never take it out. It'll never slide down the cat's leg and you can't find it, you know? So things like that. But that's a little more expensive, so we'll have to think about and balance those things.
It might increase the trust among breeders because you're not going to, when you get this across cat to your house, you're not going to, are you going to?
We're not going to swab everybody, right? So then we could just, yeah.
I'm with you. I think I'll give
I
people
think we
more
should chip them, and
trust.
because sometimes cats get moved along too. I might have the cat one day, and then she might have it another time.
Right.
And you might almost, I don't want to say get lost in the...
I understand.
A lot of sable Burmese out there. So, right.
there's another defect that hasn't been brought up yet, flat-chested kittens.
Right, yeah, right. But Susan, would you comment towards your survey that you did for kittens and?
Give me a minute to stand up and hold.
Susan, get up where the recorder is.
Oh, sure, I'll plug you in, sorry. A few years ago, a number of you in the room, I know, right, helped participate into the kitten health surveys that we did. We did them in contemporary and traditional Burmese. We did them in Euro Burmese. We did them in a number of other breeds. And one of the things that became obvious to me as I was looking at the kitten health data we collected in that survey, I don't have the numbers in my head or in front of me of how many kittens it was, but I know in the Burmese breed it was a substantial data set that we had. About 3% of all Burmese kittens born during that collection period had flat-chested kitten syndrome. 3% might not sound like a lot to you, but in terms of how common cat diseases are, that's more common than the number of cats with chronic renal disease I see. That's more common than the cats with diabetes I see. That's more common than the cats with feline leukemia that I see. That's more common than the number of cats with asthma that I see. So 3% qualifies as a common feline disease. Okay.
Doesn't mean it's genetic.
I don't know if it's genetic. We do not know the answer to that.
Compared to other breeds.
We found 3% of Burmese with that. We found 3% of Bengals with that. And we found it hardly ever, if at all, in any other breed.
Siamese have interest. They told me so.
Yeah, I didn't survey Siamese, so I can only speak to the breeds that we surveyed. We surveyed about 14, 15 breeds. Yeah. Okay.
Yep.
Pectus?
No, this is the flat chest kitten defect. So it's a defect where the sternum of the kitten is flattened and the rib cage is angled at the junction between the bony part of the rib and the cartilage part of the rib. So you can actually feel a ridge down the rib cage of these kittens, and their chest is quite flat. So some of them will resolve, some of them don't resolve. It's a very diverse defect. I don't think it's related to the traditional defect we all know, the funnel chest or the pectus excavatum, but we do not have good genetic data on either of those. So we don't know what the relationship is.
I know sometimes what I'm judging, you know.
The pectus.
Pectus, yeah.
Sure, sure.
Devin Rex, and I found it in her.
Sure, yeah. I think a substantial number of kittens with the pectus excavatum go on to adulthood and just have some tiny defect that you can feel. Yeah, so that's likely what you're feeling. Yeah.
Because I always advise people, I said, you know, make sure you talk to your vet
Yeah.
about this cat and watch it.
Yeah, yeah. So if you're feeling it, my guess is that's what you're feeling. Okay? Any other? Yeah, I'm not saying it doesn't appear in other breeds, but to my knowledge, it's nowhere near the frequency that it is in Burmese and Bengals. Those are the two breeds. Okay? Good. Here.
So yeah, something we certainly need to watch out for. Along these lines, we are kind of moving in the direction of how do we educate that we want to try to get slightly less extreme cats. So how do we start moving in that direction? And I still put this on the slide, but I've been told not to, but I'm still put it on the slide, is do you need to think about your standard? You guys always want to say the judges always want to say it's the breeders, right? So, and I hear this wherever I go in the world, right? But somehow there has to be a compromise, whether wording needs to be changed or something like, whether you can reweigh the standard, put less points towards the head or something for a while, you know, it does. You guys write this stuff, it doesn't come from Moses, right? It doesn't come, right? You can change your rules and stuff. And I'm just going to stop there because I know that's a very, very contentious issue.
You read the standard?
Yeah, but to me, I can't tell a traditional from a contemporary, so it doesn't matter, you know.
The shortest muzzle wins, and it doesn't say that kind of stuff.
Right.
It's the interpretation.
Yeah, I know that's going to be a whole nother day, that whole argument, but I want to put that on the table. So it becomes the question: should there be Euro-Burmese in the United States, or should that one big group? I've been talking in Portugal, in England, in the Czech Republic, in Australia, and I've been saying the exact same thing, that I think worldwide Burmese need to get together and share their gene pools and diversify their gene pools. So I think this really needs to be a worldwide effort. I realize we're going to have to try to figure out what we can really actually conquer. And, you know, so I realize there's going to be some barriers that maybe we can't conquer, but if we think about a small circle and we make a step in every direction, that circle gets bigger and bigger and bigger. So if we just make baby steps in each direction, I think we could do a good thing. Someone brought this up in Australia. What other things do you have your cats tested for, such that you would, at the vet, you would have to have a leukemia test or an FIB test, or maybe we can get the lab at Davis to join forces with the clinical labs, and if you need a cat tested for leukemia, FIV, well, that's a blood sample. Well, of course we can do the DNA testing from that as well. So that's another thought kind of out there on the table as well. How can we combine efforts in that regard? So there's a task ahead of us, and we have to start thinking out action plans of what we need to do.